As the world marks International Nurses Day, attention turns to the critical role nurses play across borders, especially in countries where health systems rely heavily on skilled professionals from abroad. Kenya, with its rich pool of well-trained nurses, has become a key source for international recruitment. Kenya ranks third after Philippines and Canada as a source country for nurses to the US. This raises important questions about ethical migration and the sustainability of local healthcare services. My name is Dr. Mercy Korir, and joining us today on Willow Lifeline Dialogues is Dr. Peter Preziosi. Dr. Preziosi is the president and CEO of TruMerit, a leading organization in global healthcare staffing that helps nurses and other healthcare professionals expand their opportunities by validating their training and skills. With deep experience in health workforce policy and ethical migration, Dr. Preziosi brings a vital perspective to the conversation on how to balance global demand with fairness, dignity, and opportunities for nurses from Kenya and beyond. Welcome to Willow. Welcome to our Lifeline Dialogues, Dr. Preziosi.
Thank you for having me.
Thank you very much. So as the world marks International Nurses Day, there's a growing concern about the ethical implications of recruiting nurses from countries like Kenya. How can global healthcare systems meet their staffing needs without compromising the capacity of source countries to care for their own populations?
There needs to be greater cooperation, bilateral agreements among countries as they look at the exchange of nurses and other health professionals. And one of the recommendations that we encourage international recruiters to look at how to support nurses that want to remain in their country, like Kenya. One of the challenges is that people that are capable, they have the available resources to be able to migrate, are the ones that migrate. And it's generally the best and the brightest, and those that are from more affluent backgrounds. But then what happens is that individuals that don't necessarily have the same available resources to them end up staying home. That's what are we doing for those individuals that are left behind, if you will? How are we helping to upskill that worker that is staying within their own country? And especially as we look at new technologies, artificial intelligence, digital health, telehealth solutions, precision medicine, how are we training nurses and other health workers to begin to be prepared to address those new ways of caring for people with those technologies? And that's something that I think that we need to be looking at a little bit more.
Looking at the nurses that immigrate, particularly to the US from Kenya, what are the top reasons for wanting to leave their home country?
So we survey nurses that are coming into the United States. We see anywhere between 80 to 120,000 individuals coming through TruMerit's doors as we certify their skill and competence to make sure that they're fit for practice and they're safe to practice and that they are who they say they are. I mean, fraud issues are extremely important as you take a look at migrating health professionals because there are a few bad actors out there. But what we find is after we have completed their reports so that they are then safe to practice and they can work in the United States, we survey them. Why are you here? Why did you want to come to the United States? And a third say they come to the U.S. because they want to help lift their families out of poverty. Remittances are an important part of migrating health professionals where they come into a country and they will send a certain percentage of their salaries back to their families in their home countries. Another third will come to follow loved ones. So if their loved one is coming over to the United States to work, say, in information technology, that's their spouse. They want to come over and they want to follow their loved one to the country. And then the other third come for advancing their careers through university degrees, getting their master's degrees, their doctorates. So those are the reasons why individuals come to the United States.
And is there a cap to the number of nurses and other healthcare professionals that you can process or, help validate their credentials to migrate?
Yes, there are caps for every country. So there's only a certain number of individuals that are allowed to enter into the country, into the United States from different countries. So what happens for those countries that have a high percentage of individuals coming, like the Philippines and India, for instance, they have very long wait times because they have to wait for the quota to open up for them to come into the United States. And that's similarly what's happening now in Kenya, since there's a large number of Kenyan nurses that are coming into the United States.
So Kenya is also now facing a cap.
There are, yes, we're seeing caps right now across the board. What had happened during the pandemic, the world shut down. Mobility wasn't happening. So there was a great deal of pent-up demand. So immediately, once borders started to open up again, we saw a big surge because there was a lot of available visas, work visas available for individuals. But that now has hit. Those caps have hit, and it's taking longer now to get into the United States.
Okay, all right. So how do you reckon countries and governments should balance the ethical mobility without deepening the brain drain from the source countries?
Well, I think that what needs to be done, there are a couple of things that need to be done. It's not just one different, one answer, if you will. I think one way is to begin to look at how to keep the workforce in the home country educated and advanced, providing continuing professional development, lifelong learning, credentialing, certifications that for specialty practice. We have a certification program for nurses, allied health professionals, and assistive personnel that are working in rehabilitation care. Individuals that need physiotherapy, people that are getting over a stroke, some cardiovascular accident. So there are ways that you can help to upskill the workforce into these areas of specialization. Mental health is another area. As we see around the world, there are high rates of depression and suicide now with social media and the challenges that societies are facing using these technologies. So we could upskill the workforce. So through and not only just provide this learning opportunity, but assessing them and empowering them through competency-based certifications and credentials where they can go to an employer and say, I'm a certified nurse in rehabilitation care. I am certified in emergency nursing, in emergency preparedness. I'm certified in dialysis and kidney care. There are a variety of things that we could begin to offer working with international recruiters. The other thing that we do at TruMerit is we have a recognition program for international recruiters. So we certify them based on a code of ethical standards and practice that's based on the WHO's code of conduct. So that there are requirements in there about how to treat nurses as they are migrating, to make sure that their contracts are clear and well understood by nurses.
How should countries leverage that, the upskilling, the training, when the nurses want to come back to the source country? Because from the conversations around, coming back to your source country, say Kenya, for example, you come back to the job group or to the position you are in before, yet your colleagues within the same country have advanced. And looking at why people have gone, for example, whether they went for career development, they have advanced in a certain way. So coming back and expecting them to go back to the job group they were in is sort of putting them back. And so people then are not motivated to come back. So what can countries do to incentivize and sort of motivate people and utilize the skills that they've been able to gain from abroad when they want to relocate back?
Well, I think countries have to look at the career ladder opportunities. So if we're talking about nurses, what are opportunities for advanced practice nurses to be able to work back in health systems here in Kenya, for instance? One of the things that we have found is that nurses that come to the United States and have a variety of more opportunities to practice their skills. They'll go back to their home country and they don't have those same opportunities. So they become frustrated. But then there's also the reverse. I was talking to a midwife from Nigeria that came to the United States to practice midwifery. And the scope of practice was not as great as the scope of practice was in Nigeria. So it works both ways. And I think that it has a lot to do with the way overall health systems are designed. Many times, health systems don't enable their nurses and other health professionals to work at the top of their practice because there are a lot of turf battles. There are turf battles between physicians, nurses, other types of allied health professionals.
The sibling rivalry within the healthcare
Yes,
system.
exactly. And these are challenges, and especially the greater and greater complexity of caring for people in today's societies. You know, we're all changing, and yet healthcare and the way we organize our practices, the way we organize health systems, and the way we organize out in our communities has to look a lot differently. And that's where there can be opportunities for nurses to be able to speak out and create opportunity for entrepreneurialism, you know, where they can open up their own practices out in communities. We're actually having a project right now that we're evaluating in rural villages in Rwanda, where we are equipping nurses and community health workers with a remote patient monitoring and examination device from a company called MedWand. And what we're doing is we're equipping them to go out into villages and care for patients that couldn't necessarily afford to travel from their rural villages into a city hospital for care. And we're finding that the nurses and community health workers are extremely satisfied doing that, because if they come upon a problem, a challenge, they can telepresence into a physician or an advanced practice nurse in that hospital to get consultation, so that a patient can stay in their village and be happy, work, be with their family, rather than having, and they'll have better access to the care that they wouldn't normally have.
Without needing to travel many distances,
that long distance,
be separated from family and the like. Okay, so looking at the future statistics for nurses, for example, the Global South, where Africa is, Kenya is likely to have a shortage of nurses by 2030. Could you explain that and what the dynamics would look like between the high-income countries and the low-income countries?
So what we're seeing is that demand for nursing services in high-resource countries are just growing larger and larger. But we're also seeing that same kind of demand in low-resource countries. But the population is aging out in many of these high-resource countries in the global north. So they're having to look for people. They're having to look for well-qualified nurses that are coming from higher producing countries like Kenya, like Nigeria, like the Philippines, like Indonesia. And but what happens is that many times the way nurses are educated in one country doesn't necessarily support the way that they need to be working in a higher resource country, so that there are gaps. So what I think we're starting to see more and more of is the use of technology to support nurses, so that there are models of virtual nursing care, so that you can use telepresence and technology and artificial intelligence to support and enable the extension of care delivery by a nurse. So I think we're going to see more and more experimentation with these technologies to be able to augment the services that nurses, physicians, and other health practitioners will be providing.
Now, specifically, when nurses move to US, UK, and Australia, which emerge as the top countries where nurses go to, from the many years of experience that TruMerit has, what are the challenges that they face when they move to these countries?
Well, another big area too, you mentioned the UK, Australia, US. There's Canada. There's also the Middle East, the UAE. I think what happens is that the challenges are the cultural differences. And what happens is that nurses that go into another country, they have to address the cultural differences, and they have to be assimilated. And there are not enough programs right now to really help to support the assimilation of nurses as they're going into these other countries. And unfortunately, what happens is that nurses can be discriminated against. There's a very large percentage of the nursing population that are women. So women are at risk of being exploited, particularly as they go to countries where there is an inequity in gender, where women don't necessarily have that same voice as their male counterparts do. So I think it's incumbent upon health systems that are recruiting nurses in, as well as the recruiters that are helping to facilitate the bringing over nurses, to be able to help them to be culturally assimilated so that they feel comfortable. So there are starting to become more and more programs that will help to support nurses in that assimilation process.
Do you, as TruMerit, have such support programs for the nurses, especially when they go to countries where they are likely to be discriminated either by gender, race, or sex?
We historically have not done that, and that's something that we have to look at right now. But what we have done is we've made sure that we have set standards that we can assess and evaluate nurses that are coming into the US, Canada, New Zealand, the countries that we serve, to make sure that they are well prepared. English language proficiency is an issue that is really important. You don't want to set up a nurse to fail when they come into a country. Yeah. And if they don't have the proper skill, competence, and are safe to practice, it's not only a patient safety issue, but it also is very discouraging and demoralizing to that nurse. So that's what we've cared about. But to your point, Dr. Mercy, I definitely agree that we need to be able to start to look at more holistically these issues and provide more services.
So in credentialing and facilitating the process for nurses, what do you do as TruMerit for any one of the nurses who may be watching or listening and is interested? What is the process for them to be able to get to the website, maybe get their certificates checked? What is the process for them?
Sure. So what that process looks like, it can be very different depending on what country that you're coming from. So, and depending on, say, for the United States, what state in the United States that you want to practice in. So it's like going from Kenya to practice in Rwanda or to Uganda. They're very different.
Yeah.
And that's the same thing in the United States. It's different to go to New York than it is to California, to Pennsylvania or Illinois. So there are different requirements for every state. So on our website, TruMerit.org, there are navigation. It will navigate you to how you can become a nurse in different states, and it will give you all the requirements that you'll need. But generally, what we look at is we look at the education of the nurse, their experience, 2 years of experience, of practice to be able to come into the United States to work. We look at the license that they have to make sure that their license isn't encumbered, that there wasn't any problem with the way that they were practicing in Kenya, for instance. And then that's part of the process. And then there's an application they must fill out, and then we have to receive their university transcripts and their professional license from the source, from the university itself and from the Ministry of Health that issues that license. So these are the requirements that we have.
Okay. And why is it, because these requirements for anyone who would want to immigrate are things that they would have, why is it so difficult then? What makes it very difficult for the process to advance? And is there a way technology can make it easier and smoother?
Well, we are right now in the process of digitizing our entire program. One of the things that we've done is we've created what we call a credential transfer portal so that we can connect with a secure portal to issuing authorities, to university registrars' offices, to ministries of health and nursing regulatory authorities around the world. We right now are in 70 countries, and we have some 500 issuing authorities that are digitally attached to us through this credential transfer portal. And we secure that through multi-factor authentication. So not anybody can get on there. We have to ensure that the individuals that are issuing these credentials to us for us to evaluate and review, have gone, we've vetted them properly. And so that's a big part of the way of improving the time it takes to receive these documents. At one point in the history of TruMerit, we were receiving some 5,000 pieces of mail every day.
Wow.
And now through this credential transfer portal, because we were receiving documents digitally, we've reduced that down to about 2,500 pieces of mail a day. Okay. And we still have more to do.
Yeah.
So that's one area.
Lastly, partnerships are definitely an important part to the success of any organization and its mission. In Kenya, who have you partnered with to make the processes and your work smoother, and that the application process and the journeys for the nurses and other healthcare workers are smoother in terms of wanting to migrate ethically?
Well, we've worked directly with the Ministry of Health and the regulators, and we have the U.S. Embassy here in Kenya. As we're looking at employment visas, we work directly with the consulate to assist them as they are evaluating the employment visas that we've approved through our organization. But we have to do more. So we were here in Kenya with Africa Health Business to begin to look at how we can improve those collaborations. I think that we need to have deeper collaborations with health systems, employers, community health agencies, as well as universities. We need to look at programs that will support digital health technologies, help universities as they're addressing climate change and the needs of populations as the climate is changing. There are a variety of things that we can be doing if we collaborate more effectively.
So what message in your closing remarks would you have for any nurse or any other healthcare worker who's looking to immigrate to any of the countries that we've been talking about?
Education sets you free. That's what I learned when I was a child. And I think it's really important. There's all types of ways to get educated. There's formal education in university systems. And then there are continuing professional development ways of getting educated, getting certificates and credentials that you can put onto your resumes to be able to show that you have learned certain skills and certain technologies. And I think that that's an area that I know that there are organizations that provide those types of programs to nurses and allied health professionals.
Okay. All right. Thank you very much, Dr. Preziosi, for your time, for your valued input into the conversation of, ethical migration for healthcare workers. We thank Dr. Preziosi, who's a nurse, a healthcare policy expert and the president and CEO of TruMerit. And as we reflect on this conversation, it's clear that ethical nurse migration is not just a matter of staffing numbers. It's about striking a balance between global health needs and protecting the integrity of healthcare systems in the countries like Kenya, which are key source countries for nurses. The commitment to fairness, transparency, and collaboration must remain at the heart of every recruitment effort, and we've had that today. And on this International Nurses Day, we salute the dedication of nurses around the world and urge continued dialogue amongst policymakers, healthcare leaders, and communities to ensure that the movement of health professionals benefits all. Thank you for being part of the conversation. I'm Dr. Mercy Korir, and I invite you to be part of the Willow Health community. Subscribe to our YouTube channel and our social media platforms or Willow Health Media. Until next time, bye-bye.